And in health news, United States Supreme Court Justice Sonia Sotomayor today denied an appeal from New York City Police Department Detective Anthony Marciano. Marciano asked for an emergency injunction to keep the city from firing him over its mandate that municipal employees be vaccinated against the coronavirus. Marciano refused the shot, although he didn't qualify for a medical or religious exemption. There have been more than 1,000 New York City employees fired for refusing the vaccines, and some requests for exemptions have yet to be decided. Legal challenges to the rules have mostly been unsuccessful. In more COVID news, the Biden administration released two reports on long COVID, a long-lasting and debilitating disease affecting some people who contract COVID. HHS Secretary Xavier Becerra says long COVID can hinder an individual's ability to work, attend school, participate in community life, and engage in everyday activities. As many as 23 million Americans might have the disease, which can last for months and is little understood. But Kristin Urquiza says the government isn't going far enough. Urquiza is a co-founder of the group Marked by COVID, an organization named after the death of her father, Mark, from the disease. It advocates for the needs of those people most harmed by the pandemic, mostly the poor and people of color. I spoke with Urquiza earlier today.
Well, I lost my dad pretty early on in the pandemic, and I first of all needed to connect with people who believed the virus was real, that were empathetic to the fact that I had just gone through the most horrific experience of my life. We began as a network of bereaved individuals who were having this front row seat to a disaster that half the country didn't believe was true. We all had a lot of anger about not only losing our loved ones, but the conditions that got us to this pandemic in the first place. From there, we've leveled up to professionalize ourselves to become the largest advocacy arm for the tens of millions of people who are severely impacted by COVID, to ensure that whatever comes next, whatever happens after this pandemic is in the rearview mirror, that we don't repeat the same mistakes that made this so bad to begin with. 1 million people have died. Hundreds of people are still dying, and tens of millions of people are sick from long-term COVID complications. This is not normal. Marked by COVID is ensuring that we don't write this pandemic off as if it was not a big deal, because it was a monumental deal.
What is it that makes it necessary to have this organization?
I was thinking about 9/11 earlier today as we approach that holiday, or that moment in time that is sort of thought of and revered and never forgotten. I remember very clearly where I was and what I was doing after 9/11 happened. And I personally wasn't impacted at all, even though I lived close to New York and had friends that were from there. And we completely changed our government. We created new departments. We changed the way that we approached airline travel. Similarly, we need a whole reimagination of society to ensure that public health isn't an afterthought, that whenever disaster hits, whether that's Hurricane Katrina or Hurricane Sandy or the next superbug or virus or bacteria, that we are able to make decisions that really prioritize life as much as we prioritize GDP. What we've seen is that there has been a push to go back to normal. There's been a push to reopen states. There's been a push to pretend that people's actual lives, their ability to live, that their health is in danger. And so when I think about why it is on the scale of a landscape changing events, as a world war, as a terrorist attack, this public health crisis that we've all been through and are severely impacted by.
Those folks who firmly believe that the injuries, the true injuries, are coming from what they consider forced, they don't even use the term vaccination, but forced vaccinations in their minds.
The largest harm that I see right in this moment is people being forced to go back to work without sick pay, without job security, that if they get sick, they can take time off and be able to recover. Millions of people who are living with long-term COVID or long COVID that are unable to work or are working reduced hours and are falling into financial disarray. These are the people who are continuing to have already suffered and are continuing to suffer from the decisions that we are making. As Americans, as a country that's built upon these foundational documents, we need to do more to ensure that folks are protected during these really uncertain times of communicable diseases that are kind of left unchecked.
Kristin Urquiza is a co-founder of Marked by COVID, a group that advocates for the need of those most harmed by the pandemic. In more news, is it possible that New York State Governor Kathy Hochul, the moderate Democrat from Buffalo who rose to office after shamed Governor Andrew Cuomo resigned, is willing and able to put thousands of New Yorkers in special quarantine camps if they're deemed carriers of a dangerous disease? A law to that effect was dropped by its sponsor, but opponents of the measure say since Hochul can't pass the law, she's using a regulatory backdoor to get the same power through a much easier to implement regulation. Meanwhile, a group of activists feels the true victims of COVID and any future transmissible disease are not just the thousands who've died, but the millions required to take the COVID vaccine whether they want to or not because of government mandates. Martha Rowen is a candidate for New York State Senate in the 26th District in Brooklyn. She's a member of the recently formed independent party called the Medical Freedom Party. The party says their mission is to bring the issue of bodily autonomy and individuals' basic rights to decide on health care for themselves and their children to the public. In other words, they believe vaccine mandates are a danger to health and the Constitution.
I'm running because over the last 2.5 years or more, it's been extremely disturbing to see what's happening to our society and the future of our children with increasing, I don't hesitate to use the word totalitarian measures. We have a governor who is continually reinstituting a state of emergency that never seems to end. She is appealing a decision by the court that her plans to institute camps for people that she alone, with nothing from doctors or any kind of due process, can decide a health risk, just on her own say-so, put them into camps for as long as she wants.
Pretty strong statement.
They are called quarantine camps, a reality. If there was an attempt...
to these quarantine camps, from your understanding? Who are they for?
Anyone that the governor decides on her own initiative is a risk to public health. That is a very broad definition. It doesn't say that a team of doctors has decided that this person has been diagnosed with some kind of a serious infectious disease, which is extremely dangerous, and they're going around coughing in people's faces. No, she gets to decide this on her own, and it's also undefined. She could decide, I suppose, that somebody like me, who not only does not want to take this so-called vaccine, but who thinks that other people should have a right to refuse it, is a risk to public health because she thinks that people should be forced to take it.
Okay, let me ask you about your party, the Medical Freedom Party. What is the purpose and what's going on with the Medical Freedom Party?
The Medical Freedom Party is the political division of the Medical Freedom Alliance. We're a group of New Yorkers who have gotten together over the last few years to educate ourselves and to talk about ways to deal with the situation with this oppression and problems with all the issues with COVID. We decided that one of the ways in which we could be active was through politics, and several people in the group looked into what politics involved. They became involved in other people's campaigns, and then we decided maybe perhaps we should consider forming a third party. We made the decision on the day after Easter that we would form the Medical Freedom Party. And since then, we have gotten through going out and getting petition signatures among the public. We've got 8 candidates on the ballot in November, because people really are beginning to say, what's going on here? Why can't I make my own decisions? Why am I being thrown out of my job because I don't feel that it's safe for me to take this shot?
You were instrumental in drafting a letter sent to the New York City Health Department, Mayor Adams, and the City Council.
It is a letter addressed to the Commissioner of the New York City Department of Health and Mental Hygiene, because when we looked at their page where they give advice to parents of children and actually very aggressively pushing parents to get their young children, and we're talking about babies 6 months old and older, to get this so-called vaccine. Basically, what they have on the website is just full of misinformation. We consider it dangerous. Their claims that children are at huge risk from COVID is completely unjustified. Young children are extremely low risk.
Martha Rowen is the Medical Freedom Party candidate for New York State Senate in the 26th District in Brooklyn.